April is National Minority Health Month, a time to spotlight the social factors that shape our well-being, from access to care to the neighborhoods we call home. It also highlights the health disparities affecting many racial and ethnic minority communities. Here to discuss what health equity really means and why these gaps persist is Dr. Taneve Escamilla, a family physician with Optum Care Washington. Thank you so much for being here today.
Thank you for having me.
So when we think about National Minority Health Month, why is that so important for us to recognize?
This is such an important month because it really brings awareness to the health disparities that affect so many minority groups in the U.S. And in the U.S., our health is really shaped by who you are and where you live, the zip code that you live in, and that's because it determines what resources you have access to. So this month is really about increasing momentum in identifying and addressing health equity, health disparities in minority groups, because we all deserve good health.
And when you talk about health equity, what does that look like in the practice?
Yeah, health equity means that we're giving everybody a fair chance to achieve their best health, and that means meeting people and communities where they're at. Every community has different barriers to having good health. So when we're looking at health equity, we're looking at the social determinants of health. Those are the social and environmental factors that affect everyone's health. And when we are able to address social determinants of health and increase health equity, we have less health disparities.
When we think about health disparities, and you're saying, meet people where they are, why do you think this just continues to persist and affect so many communities here in 2026?
Yeah, because there isn't just one solution. It isn't about one size fitting all. Each community has different needs, and so it takes looking into what resources have gaps in different communities. So it takes different types of advocacy to bridge those gaps in different communities.
Which racial and ethnic groups are you seeing be most affected and impacted by these disparities?
When we really zoom into the data, to racial and ethnic minority group data and health disparities, we see the largest health disparities in Black American, Latino, and Indigenous communities in the U.S. So this is where we're seeing the highest rates of chronic and preventable diseases and cancers, as well as preventable cancers.
So when we think about the Black community, what trends stand out for you?
When I think about our Black community, I think about diabetes. We have higher rates of diabetes in Black and Latino communities. However, in Black communities, they have higher rates of mortality due to diabetes. 80% more higher rates of mortality compared to other groups.
My goodness. And for the Latino community, because we just had a full screen a few moments ago, what would be the trend that has mostly stood out to you?
Yeah, what has stood out to me is the lower rates of accessing preventive care. And I think that causes multifactorial, but there's also very specific data on lower rates of not accessing preventive vaccines.
What steps, I know a lot of people are watching this, so what steps can we take as individuals and as a community to move closer to making sure that true health equity is available for everyone?
Yeah, I think understanding that social determinants of health are the social and environmental factors that are affecting people's health really highlights that there's an opportunity for action and advocacy, and that each of us can have a lot of advocacy in our own communities.
Well, thank you so much, Dr. Escamilla, for being here with us today and just sharing your wealth of knowledge.
Thank you for having me.
Of course. Well, for more information about your Optum Care options here in Washington, head to the website on your screen.
New Day Northwest is sponsored by Optum.